Hello everyone. Today we are going to discuss what is pericallosal lipoma. So, what is its etiologenesis? It basically developed from embryonic meninx primitiva. It is basically a type of embryonic mesenchymal tissue. So, normally this meninx gives rise to cranial meninges. And if there is any mal-differentiation and persistence of this embryonic meninx primitiva, it gives rise to pericallosal lipomas. So what is the site of lipomas? Normally in 80% of cases they will be located above the tentorium, that is they are supratentorial in location, and IHF, that is intrahemispheric fissure, is the most common site of pericallosal lipomas, and in 20% cases they are infratentorial, that is located below the tentorium. So how will the patient present? That is the clinical feature. Normally the patient will be asymptomatic and thus this will be a incidental finding. A point to note is that these lipoma encase the vessel and nerve, so they are also known as leave me alone lesion. Now let us see how will they appear on the imaging. So this is the first image. This is a NCCT head image. Here we can see there is presence of this hypodense lesion. So firstly we note this is hypodense lesion and the CT value was -52 -80 HU, and this is the attenuation of fat lesion. So hypodense fat dense lesion, and we also see the peripheral calcification. So these features are suggestive of pericallosal lipoma. So this is the first example of pericallosal lipoma. Now let us see the second image. Again, this is a NCCT head image, and here also we see the hypodense lesion. Again it is of fat attenuation, that is -52 -100 HU. So this example is also example of pericallosal lipoma. So basically both these examples of type of pericallosal lipoma. So let us again see the first example. This example or this variety is known as the tubulonodular variety of pericallosal lipoma. So we will compare both the first and the second images. This first one is tubulonodular and this second one is curvilinear type. So the tubulonodular is the bulky one, as we can see, and usually more than 2 cm in thickness, and this curvilinear will be pencil-like and less than 1 cm in thickness. This tubulonodular lesion is usually associated with severe corpus callosal anomalies like agenesis. While this curvilinear type of lipoma, this is usually associated with dysgenesis of the corpus callosal lipoma. Now let us see the next image. Here we can again see this is the lipoma, and here we can observe both these frontal horn, these are widely spaced and arranged in parallel direction to each other. So these features are indirect signs of the corpus callosum agenesis, and this appearance is known as racing car appearance. This is the axial image. In the coronal section, in the same corpus callosal agenesis, we will see The frontal horns are giving the Viking head appearance. This is the Viking head appearance. So how will the lipoma appear on the MRI? This is the T1 and T2 MRI. As this is a fat density lesion, so it will be T1 and T2 bright. We can see it is T1 and T2 bright. And if we do the post contrast MRI, there will be no enhancement. Okay, there will be no enhancement. So this will be all for the video. Thank you everyone, and if you liked my video, do subscribe the channel.